Things to think about on physical exam. We talked a little bit about history. What do we look for on physical exam? If the head circumference is greater than the 90th percentile and rapidly crossing percentiles, that's a concern. Cranial nerve exam, looking for papilledema, as you see here in this eye exam on the right. If there's loss of visual fields, if there's head tilt, a double vision, if the child tends to read or look with one eye closed, if there's paranoids where the eyes are pointing down and they don't have good upgaze, all worrisome findings on cranial nerve exam. On the general physical exam, identifying pronator drift, reflex changes, weakness, any focal deficit really merits evaluation. And on a cerebellar exam, if the parents say, gee, my son or daughter is a little more clumsy, looking at their gait, their finger-nose-finger exam, identifying a posterior fossa lesion can be revealed by these types of physical findings. In general, looking for cutaneous lesions, such as you might see with tuberous sclerosis or neurofibromatosis type 1, can sometimes herald underlying problems intracranially or within the spinal canal. And it's worth asking about these both on physical exam, disrobing the child if necessary to look for these, or talking about family findings if they're present. Other things to think about that might not be readily evident, the head circumference we talked about. If the young child is present, has a full fontanelle. If the child has torticollis, perhaps with irritation of the meninges, tilting the neck. If they have scoliosis, if they've had weight loss, if there are endocrine findings like galactorrhea or growth abnormalities, and if there's signs of dehydration or infection, such as might be present in sinus thrombosis, all worrisome findings. The real red flags that merit urgent consultation would be bradycardia, hypertension, decreased respirations, the so-called Cushing's response from pressure on the brainstem. If you have a dilated pupil and hemiparesis, the uncal herniation, and typically if you have a dilated pupil on one side, the weakness is on the opposite side. So for example, a dilated right pupil will be associated with left-sided weakness. If they have fixed downward gaze, the paranoid syndrome, if they have lethargy, a young baby with a tense opium fontanelle, or if they have ataxia with nausea and vomiting, all red flags. Looking here, for example, you can see a pineal tumor circled in the blue here. It's blocking the flow of spinal fluid, giving the kid headaches, but also a paranoid syndrome as the midbrain controls those types of eye movements. Moving a little higher up, this uncal herniation, you can see on the right side some ptosis and a dilated pupil associated with uncal herniation. And then, as you can see here in this axial CAT scan, the tonsils compressing the brainstem right at the dead center of the scan, and this results in these findings of bradycardia, hypertension, and decreased respiration. So really a major red flag and really warranting urgent transport to a center capable of handling major problems.